Hello class. One of the main objectives of our whole course entirely is to learn how to schedule patients. So this is something that you might have to do even if you aren't going to go into front office management. You want to be a back office assistant or a hygienist or another part of the dental office team. This might be something that you're going to have to learn how to do one way or another, and it's really, really important to learn how a patient schedule works. So please pull up your PowerPoint presentation and follow along with me as I go through that along with you. So the two main elements in patient scheduling is going to be the mechanics of scheduling. So this is selecting the appointment book, how you're going to do that, whether it be manual or electronic. These days, most offices will do electronic, but it still works the same way on how we schedule, whether it's written or electronic. And then how we matrix or outline, which means how we are going to put the schedule together. And will include putting in their office hours, breaks, and entering appointment information. So another component is going to be the art of scheduling. So this has to work with the dental team together to identify what are important times for certain procedures, meetings, things like that to meet the goal of the team in general. So this is going to be different in every office that's going to run differently. So you will have to learn how they do their scheduling. So moving right along to the next slide is you're going to see the appointment book. So this is what you're going to use as an example when we do our assignment for this week's module. So this is what your appointment book is going to look like. So you see the arrows in the picture starting from the top to the bottom. That's going to show us how many units of time we're going to schedule for that patient. And you're going to be drawing those same arrows as well as the patient name, the procedure they're having done, and their phone number. So this is what an appointment matrix looks like. Really fancy word for an appointment book. So this is customizable to your dental office. So outlining, depending on how you do your appointment book, you can assign each doctor a treatment room or a column. So in my dental office, every doctor, or what we call a provider, so that is the doctor and the hygienist, they have their own different columns as well as different colors. Because it is electronic, we are able to customize that with different colors. Here on our appointment book, you're just going to do different columns, and it is your choice. If we do a one doctor practice, that will be easier to do for you. So you assign them treatment rooms, and then you finish up the day. If you see all the way down at the bottom, there are X's going through the bottom. That means the office is closed. Same thing at about noon, you see 12 o'clock, there's X's marked. That means lunchtime. So that's what you're going to use in your appointment book in this week's assignment to show me when the office is open, when it's closed for lunch, when it's closed for the day, and it can be different depending on what you choose and what you pick as normal business hours. And then you're going to do little tiny X's what a buffer time is, and we'll explain that as it's going on. So a buffer time is talking about where you're going to squeeze an emergency. So you do want to schedule in about 10 minutes in your schedule once a day on where you can put them in. Because as you can imagine, if you have a full schedule of patients and somebody calls in with an emergency, you want to be able to see them that same day if at all possible to address any discomfort. So moving along to the next one is, as you can see, we changed the color here. That can change, the day of the week. That way, maybe all of the pages on Monday are blue, all of the pages on Tuesday are pink, just like this sheet, yellow. However you want to do it, or like we talked about on the computer, it could just mean different columns. So what the colors are going to do is help you just identify the difference and the different components that you decide to use. So one thing that we like to do in the beginning of the year, I do this a year in advance, is to mark in the calendar when holidays are. So you want to make sure to X off or close the office. That way you don't book appointments on the day that the office is closed for the holidays. Another thing that you could put in the office book is going to be doctor meetings, education courses, any vacations, anything that's important for the office. So when we do this written, which is what we were going to practice this week, always in pencil. So this is something that's going to be pop up on a quiz or the final, is that for specifically the appointment book only, this is in pencil. Can anybody guess why we do this in pencil? I'm going to give you a minute to think about it. Why do we put this in pencil? Well, if you guessed right. It's because we have to erase, right? So when we schedule, we want to be able to delete on the computer or erase if something changes. So that's something that is part of the art of scheduling, is that people do change their appointments, life comes up, things happen, you want to be able to erase that. So this is one of the few things in this class that you will do in pencil. So we have that highlighted. Highlight that, underline it, put it in your notes. This is a key component of scheduling, is that always in pencil. So moving on is we want to determine as a team what is going to be most productive. When does the team work smarter and faster? So as a rule of thumb, patients and ourselves, we're freshest first thing in the morning. So it's best to schedule those hard procedures, those extra tough patients early in the morning, because they do better. As you can tell, if you've worked all day and a patient's either gone to school all day or gone to work all day, and then they have to go through a tough procedure at the end of the day, that is not ideal. So we try to schedule those first thing in the morning when we're all fresh, ourselves, the doctor, and our patients. So you have to decide what you're going to do there that's going to work best for your team. And that will change depending on the specialty. Is it general? Are you working in pedo? Is it ortho? You're going to have to determine that depending on the office that you work in. So how you schedule it is going to depend on how successful or unsuccessful your practice is. So you have to learn a good appointment control makes the day run smoothly. So again, highlight that as an important component, is that the schedule has to run smoothly to be the most productive. So that also means that you don't want to schedule something at 8:30 and then it finishes at 10 and then you're done for the morning. That's not very productive. You want to make sure you schedule enough time for the procedure, that way you're not late running into the next patient, and then that you are seeing patients right afterwards, so there's never a time where you're not working. So you want to go through that. I like to keep a list of school holidays, spring break, things like that, for when a busy time that patients are going to want to schedule in. Because if you're booked all through the summer and then the kids are scheduled to come home for break, you want to make sure that you have that open for them. Another important thing to highlight is this is not used as a staff personal calendar. This is for the doctor. This is for important things for the practice as a whole. It is never to be written for anything personal that has to do with staff, okay? So when we book appointments and we schedule for the following day, we want to confirm those appointments either by a phone call, a text message, email, or appointment cards. And every patient is different. In our registration form, we like to take that information on what is the best form of contact. That way we know how they want to be communicated with. So some people like their email, text message, appointment card, postcard in the mail, all of the things. But some people say, don't even remind me. I don't like the reminders, spam, with all the text messaging go out there, and some kind of a little bit of both. So we have technology now that has the ability to do all of those different things. So the most important thing is to remember that everything should be legible, whether it's computerized or manual, in there. That way anybody can read it, because even though if you're the person most in charge of the appointment book, it doesn't mean you're the only one that's going to read it. So you just want to make sure everyone that can read it. So the most important thing is that you don't want the appointment book in full view of the patients to see. One, privacy. Two, you don't want them to pick their own appointment, because say you have a big block of time and you have patients scheduled in the morning. You don't want them to fill in their own spot, because you want to kind of stack everybody together instead of everybody really spread out, because that's not very productive. So you want to make sure that all of the charts that are checked the day before, to make sure you have all the information that you need for that patient. For example, if they're getting a denture case delivered or a crown delivered, you want to make sure that case is in the day before. So you're looking at the schedule, making sure what are the instruments or what are the items that you need for the patient the next day. So one thing is that, you want the schedule to run smooth. So if a patient is not arriving on time and they're late, you want to make sure to give them a call and try to see where they are. If somebody calls in last minute and cancels, you want to make sure that you have a list of those patients that are looking for a sooner available appointment. That way you have someone to fill in that space. So we are now moving to slide number 9. This is going to show you what the units of time are. I know we were already talking about it a little bit. Units is just how much time that you're going to allow in your appointment book. So you can run, every 15 minutes can be a box. If you look at the sheet compared to the slideshow, it has a little line in that box. That's every 15 minutes. You can do every 10 minutes, every 20 minutes, every 30 minutes, just depending on what your office does. A lot of computerized appointment books will run every 10 minutes. So for example, talking about a unit of time. If we're talking about 15 minutes, right? We already told you we're going to run on 15 units of time. 15 minutes would be 1 unit. Okay, is everybody on the same page with me? So if a procedure is 2 units, that is 15 plus 15, meaning it's a total of 30 minutes. So you will be tested on this. We will let you know what unit of time we're working with. In this appointment book, it's going to be 15. So if something is 4 units, that's 15, 15, 15, 15. That is 1 hour. So 15, 30, 45 minutes, 1 hour is 4 units. Message me if that doesn't make sense. I want to make sure that you all get that, because that's how you're going to be working on your assignment, and that's what you're going to be tested on your quiz and your final. You will have to do that to total on, or they might give you the units, 2 units, or they might say this is going to be an hour procedure. How many units is that? Okay. So the most difficult procedure should be in the morning, as we discussed. When a patient is calling for an emergency, you never want them to think that they're not important, or, we don't have time for you because the doctor's too busy. So you want them to be important, just like everybody else. When you have a dental emergency, you're not in a very good mood, you're in pain, you want to feel like the most important person. So just say, if there's anything we could do, we'll let you know. We'll try to get you in as soon as possible. So same thing. You don't want patients making their own appointments, and you want to make sure, if they are someone that likes appointment cards, which a lot of people do, is you put all of the information on your appointment book first, write it in, then put it on the appointment card. I know with how busy offices go, you're checking in a patient, you're taking a phone call, you're getting insurance, things like that. It's important to take the time to either type it in electronically, or if it's handwritten, that the appointment is on the book before you write it, because you don't want to write an appointment card, give it to a patient, and then forget to enter it in and then move on with your day. And then the patient shows up, they have the appointment card that you wrote them, but they're not on the book. So you want to make sure to avoid that mistake at all possible. So if you have any questions, please let me know. We are going to be working in appointment matrixing, which is just a fancy word for scheduling patients in the written appointment book. Please reference back to the PowerPoint and this discussion. That way you can see what we're going to be doing. So if you go back to slide 9, it's going to look kind of like this, and you're going to mark off those X's for the opening, closing, lunchtime, and buffer time, which remember, that is the time that the patient you're scheduling for emergencies, and you want to schedule that for the 3 days that you're working with. As a rule of thumb, it's best to put that time in either right before lunch or right after lunch. And the reason why that is because you also don't want to leave behind a big hole in your schedule in the middle of the day. So for example, say you don't have an emergency that day and you have that extra 10 minutes, you don't want it in the middle of your day. You want it kind of right before lunch. That way you can, wrap things up for the morning, or right after lunch, get all of the extra things needed to be done, because working in a dental office gets really, really busy and there's always something to do. So it's best to do it in those more free times. Okay, again, message me if you have any questions. Go to the Q&A discussion forum and ask each other questions. That way you can help one another out. And I hope you all have a wonderful